What does a bone marrow biopsy show for stage A lymphoma? Imagine trying to find out how lymphoma has spread in the body. A bone marrow biopsy is one of the tools doctors use to check if the disease has reached the marrow inside your bones. For stage I lymphoma, the disease is limited to just one lymph node area or a single extranodal site, like a small part of the stomach or skin. In this early stage, the disease has not spread to the bone marrow, so a bone marrow biopsy usually shows no lymphoma cells there. The main purpose of this biopsy is to see if lymphoma cells have infiltrated the marrow tissue, which is usually taken from the pelvic bone. Because lymphoma can spread diffusely, imaging tests like CORT scans or PET scans might not always detect marrow involvement. The biopsy provides a more precise look at the marrow itself. If the biopsy finds lymphoma cells in the marrow, it means the disease has advanced to stage 4, which involves widespread marrow infiltration. But if the biopsy is negative, it confirms that the lymphoma is still confined to the initial site, supporting the stage I diagnosis. In some cases, especially with certain types of lymphoma like extranodal marginal zone lymphoma, doctors might decide a bone marrow biopsy isn't necessary if imaging and clinical signs strongly suggest the disease is limited. This is because marrow involvement in these subtypes is rare and doesn't usually change the treatment plan or outlook. Knowing whether the marrow is involved helps doctors determine the prognosis and plan the best treatment. If the biopsy shows no lymphoma cells, the outlook is generally better, and the disease is considered less advanced. If lymphoma cells are found in the marrow, it can mean a more aggressive approach is needed, and the prognosis might be more guarded. Today, with advances in imaging technology like PET scans, some doctors are reevaluating when a biopsy is needed. PET scans can sometimes detect marrow involvement non-invasively, but the biopsy remains the most definitive way to assess marrow infiltration. In summary, in stage I lymphoma, a bone marrow biopsy typically shows no lymphoma cells, confirming the disease is still localized. If lymphoma cells are present, the stage is upgraded to stage 4, which influences treatment choices and prognosis. Always remember, each case is unique, so discussing your specific situation with your healthcare team is essential for the most accurate assessment and personalized care.